Hey, I want to introduce to you Ariel Koch. Ariel Koch is going to talk about her child, Julia. And the reason that we're doing this is to tell you about Julia, to tell you about Ariel, but to tell you what you need to do, to survive in the medical system. Remember, I've been telling you about that. You got to survive in the medical system. Welcome, Ariel. How you doing?
Hi, I'm good. Thank you for having me.
So what's the story? What happened?
Well, my husband and I started fostering children for the state, and a little girl came into our care, an infant who was born drug exposed, and she ended up coming up for adoption, and my husband and I decided to adopt her.
Because you're good souls.
Yeah, well, we loved her, and
Yeah.
you know, we wanted to give her a family, and she
Yeah.
was 2 at that time, so she was attached to us, and we knew she had some developmental delays, and we weren't aware of any other issues. And as she grew up, it became pretty evident that she was going to have some significant behavioral concerns.
Tell us what you mean by that. What is it like now living with Julia?
She's extremely aggressive. She has increasingly aggressive behaviors at school. She began hitting other kids, spitting at them, biting them, running out of her classroom, tearing things off the wall, hitting at her teachers, trying to pull their clothes off. You know, at home, she pulled our blinds down. She threw rocks through our sliding glass door. She threw a rock through our TV. She was assaultive to our younger daughter. She started becoming very aggressive with our animals.
How aggressive?
Well, she ended up, at the worst of it, snapping the neck of our family cat.
So she killed the cat?
She killed the cat.
So she's a danger to herself.
Absolutely.
She's a danger to others.
Absolutely.
You didn't know that, but you did this out of love.
Yes.
All right.
Yes.
So now you got a problem, and you love her, and you want to
Yes.
help her.
Yes.
Right? And she's been through multiple kinds of treatment.
Yes.
And then what happens? She ends up at a hospital, Phoenix Children's?
Yes. Yes, I took her to our outpatient psychiatrist. I had first tried to work with Magellan, who had covered her, to get her...
Explain who Magellan is, important in this.
Magellan is a private company that contracts with the state to provide mental health coverage for, I'm not sure if it's mostly low-income kids. Our kids are covered because they're adopted, so I'm not sure.
But it's basically acting like an insurance company.
Yeah.
Okay.
Yes.
So go ahead.
So we put in for services through Magellan. We tried to get her into a therapeutic home, somewhere where she would be safer. And those requests were denied by Magellan. So it ended up where we were in the emergency room at Phoenix Children's after she had killed the cat, after she kept saying she was going to kill our younger daughter, when she started throwing herself out of the car, when we really knew that something was going to happen to her right away. And she was admitted to Phoenix Children's Hospital. And there was still no plan. Phoenix Children's Hospital was great, but what they do is acute med stabilization, and she needed more longer-term treatment.
She needed a long-term plan.
Right.
Where was Magellan in this?
Magellan at that point was saying that most of these behaviors stemmed from her developmental disabilities. And what that came down to is she was receiving services from Magellan as an insurance company and from the Division of Developmental Disabilities, which is a state organization that provides services for developmentally delayed kids like physical therapy and occupational therapy and speech therapy, who have always been providing services to Julia. And we're always very competent at what they do, but this was beyond the scope of what they handle.
So what was Magellan doing? It was denying you additional care?
Yes.
They try to punt it off to somebody else's responsibility? Is that what I'm getting?
Yes.
And there's more detail about this, by the way, for everybody who's watching this in the Arizona Republic.
Yes. Magellan's system is set up. They came out with a packet that you can Google online about their stance on residential treatment. And as a company, their stance is that the child has to try and fail every other type of intervention.
Including possibly killing parts of your family.
Right, to keep them in the home. And for some children, that's appropriate because in ideal circumstances, you don't want to remove a child from the home. But in certain situations, by the time they failed, people are hurt, people are dead. It's not always an appropriate, it can't be a one-size-fits-all.
Is this because they're trying to help the patient, or is this because they're trying to find ways not to pay?
I believe it's because they're trying to find ways not to pay. I also believe they rely on other private companies that they subcontract with for reports. So they may not be getting the information that they need to make appropriate decisions.
What did you do? Is she home now?
She's not home.
Why?
Because when they started talking about discharging her, I started talking to the social workers, and I said, we can't do this. It's not safe.
So what did you do?
Well, the hospital said they would discharge her. The social worker said, not the social worker at the hospital, but someone else involved in the case said we should refuse to pick her up. And the hospital's stance at that point, they have to call CPS because of
Child Protective Services.
Yes. And so the advice to me by the treatment team was to get a lawyer.
Did you?
No.
Did you fight for her?
Yes, I felt like I didn't need a lawyer
What
because
did
I
you
hadn't
do?
done anything wrong. I called the governor's office.
And
I called the media.
what happened?
Both of them responded. And
Here we are.
Yeah, and here we
are.
are. Here we are. The governor's office was very helpful in getting some key people involved. And now everybody's working together and
This was a long
getting
fight.
things done. This was a long fight.
If you're wondering why I'm prompting, Ariel, it's because I want to make this as short as possible so that you get a capsule view of what you all need to do. Okay. You got it done. What's happening this week?
She is going to be transferred to a facility a residential treatment facility out of state.
That specializes in this kind of care.
Yes, and we don't have the facilities within the state to treat these children.
Okay, probably another reason that the insurance company didn't really want to pay this bill.
Right.
It's a lot of money.
Right. It's a lot
You
of
did
money.
an enormous amount of work.
Yes.
What's your advice to people when an insurance company denies you care?
I think the biggest piece of advice I can give other parents is to try to be as emotionally detached as possible. This is your child and you're emotional and you've been through a lot, but you need to be able to communicate effectively with the insurance company, with the doctors, with people you're handling. And as soon as somebody has said that there's nothing more they can do for you, you need to go to the next higher person.
Never take no for an answer.
Never take no for an answer.
We're going to see more of this happening in insurance programs in the future, you think?
I believe so, yeah.
Ariel Koch.
Yeah.
Julia. And you're probably going to have, if you haven't seen already, you're probably going to see a picture of Julia. I thank you both because what you've done is a lesson for all of us, and it makes the point. You got to stand up and fight. Things are going to get tougher. You got to look out for your family, your children, and your loved ones. This is Dr. Sam Benjamin with medical news I think you can use.